Trigger point therapy is something that I used a lot this last track season in order to take care of my body, take care of my muscles, and increase my range of motion after tightening up during really intense track workouts. So basically, a trigger point is a taut band of muscle located within a larger muscle group. Trigger points can be tender to the touch, and they can refer pain to distant parts of the body. So if there is any pain, doing these little exercises of sorts will help to decrease that pain, and even if there isn't pain, you definitely get an overall better range of motion throughout your body, which feels great. So the first one is this little guy, which will help us with our soleus. So there are two parts of the calf muscle. This will help the soleus, and you place this block here, this little guy on top. Place your foot or your calf right on here, about 1 inch below the meaty part, your gastroc, 1 inch below that meaty section. You put your foot on like so, put another leg on top for some weight, and you just kind of roll back and forth a little bit like so, and then you take this bottom leg and you make rotation. So do 3 big circles to the right and then 3 big circles to the left, and it really digs on in there. And then move your leg internally an inch, do it again with the rotations in the back and forth, and then move it outside an inch as well. Same thing, back and forth, and then the rotations. So do that with both legs, and then replace this with this guy, little ball, and now put this guy, this little trigger point ball, right into that big meaty part of your calf, your gastrocnemius. So then, same thing, stack your legs, dig it in a little bit there. Oh, feels good. And then this time, I'm going to have you do the same thing where you do just the rotations, 3 or 4 to the right, 3 or 4 to the left, and then foot slaps. So basically, bring your right foot up and then slap it down. Oh, bring it up, slap it down. And every time, that ball just digs further into your calf, and it just breaks everything up, takes that trigger point, breaks it up. And same thing where you move an inch to the side, inside, do the same thing, rotations, one way, all the way the other way, and then foot slaps, and then move it out to the side as well, rotations, and foot slaps. Oh, already feels better. Nice increase in elasticity, and then you can move on to another one of my favorites, the IT band and quad. So this is the quad baller. It's a larger version of what we used on the soleus foot baller. So take this guy here, and you place it right above your knee. This will work your quad. Then you can work a little bit over to the side, get your IT band all the way in through here. So just above your knee, roll your body down an inch, and then up half an inch. Down an inch, up half an inch. So you're digging in like that, and then do cross friction. So move to the side, one side to the other side, like so a few times, and then bend your knee up and down. And we're just digging in, we're just breaking it down. Oh, that feels good. So go ahead and do that on both legs, a little to the outside, totally on the outside to your IT band. Break up your whole quad and IT band region to make sure that everything is feeling nice and loose.